Menteri Ketenaga Kakot Kakia uba ALHEC ulang bagi sarkar ke Mega Health Insurance Scheme kan anjing mentoy ya palat lailak kilong yeng hak jela barok kawe. Ya kini uba ALHEC ula jubab halor kamat balak wanda du MLA kemaulai bala ya shimbentalang buat uba HM Shangpliang bat kiwe ki balak dawa bagi sarkar kedai ban pinbait bah ya kini ke scheme kenang bagi pat ba kinlat nakajing habaki let syak sumar syaki jaka tumar repair namal batang na idau berit kalau wanda ke huri-hura bat ke pensngosi ekinong kendong nakaliang uba hek ula ang baka sarkar kan pentreka miyakani ka scheme na do ubenai banwan habaro kawe ka jila klem danyo ubarus pa ne ubaduk lanyo ekinong tre sarkar.
So this Mega Health Insurance Scheme MHIS is a universal health insurance scheme in the state of Meghalaya utilizing the existing RSBY framework to provide health insurance to all persons that are resident in the state, excluding state and central government employee. The MHIS was launched in 15 December 2012 with an objective to provide financial aid to all citizens of the state at a time when hospitalization and reduce the out-of-pocket expenses of the general public. We are happy MHIS has given the services to the poor people in the villages, in the whole state, through different civil hospital, through different institute, through different private hospital, through different CHCs and PHCs. As we know from the website of the health department, around 110 PHC, 28 CHC, 15 private hospital and 15 civil hospital and institute has been entrusted and within the ambit of this MHIS to give this insurance scheme to the poor people. And we are happy to learn that this MHIS 2-3 has done very well. According to the claim status in the website, we have seen huge amount, crores of rupees has been disbursed in MHIS 2 up to 25th April 2017, around 53 crore 16 lakh 35,072 has been disbursed. MHIS 3 till 2nd October 2017, another 13 crore 26 lakh 22,934 has been disbursed, and so on. It is a good initiative taken by the government, this mega health insurance scheme, which has been cover and help the poor and the needy in the villages. 5 members from the family included in this scheme. I want to know from the Honorable Minister whether it's the fact or not through Ayushman Bharat that the limit is unlimited, that the whole member in the family, it can be included in this scheme. At the same time, as our colleague has already mentioned, so many complaints comes from the patient at the time when they have to discharge from the hospital. They face a lot of problem at the reception when they pay their bill, when they swipe their card. There may be error. So many times it is not accepted. People are running right and left with the hope that with the helping of this card, the bill will be reduced and they might pay only a little bit to get rid. But it is not happen at the ground reality in so many hospitals. It seems that the report is coming that there are so many errors in the card. So we'd like the department to find out the genesis of these issues, because this is really affected the patient at the time when he discharged from the hospital. At the same time, the process of enrollment, it is a huge task for the government. It is a huge task for the companies who have been entrusted to go to the villages for enrollment. We want a wide publicity has to be there so that each and every family will cover under this scheme. At the same time, there has to be a clarity on which kind of diseases that this insurance scheme
of facilities lack of attention from the medical side. I feel that this is a policy matter. This policy, it need to strengthen, it need to adopt a system which need to put forward that every citizen should have the courage, should have the confidence. As I don't want to go detail, just a few points I would like to highlight in the floor of the House, especially for the Minister in charge, that asking for financial assistance without adopting a clear system is useless, is meaningless. Why? As we have seen from time to time, Mr. Speaker, sir, we have received many complaints from different hospitals. As I would like to put forward, like the Minister in charge, like the previous session, has assured the House through your respective chair, that he will implement by setting up a blood bank in each hospital, government hospital especially. This rule has been passed by the union ministry, that it is mandatory that all government hospital there should be a blood bank. But this is also a failure. 46 years of our statehood we have attained, and still we are lacking behind, and we claim ourselves that we are striving ahead. So please take note of this. This is a very serious matter. It is very serious concern of each and every citizen, as we are all concerned about the family welfare. Welfare, it might turn up into family welfare. Who knows if we cannot tackle this issue, as I've mentioned, that this is a matter of policy. So the insurance, this Meghalaya Mega Health Insurance Scheme, it should be clear enough after enhanced to 5 lakhs from 2.8 lakhs, because many people are getting confusing. It has not done in a proper way. The government and the institution heads, they should work together and make a clear awareness to all the surrounding, so that this awareness, it should be reached each and every household. This will be a great benefit, especially for the people who are looking to get the benefit from the scheme. So the major point I would like to urge the Minister in charge for passing this demand number 7, that it should ensure the House that soon we would like to see that this all blood bank should be well setting up in hospital especially.
Table this motion which has provided that this House an opportunity to discuss the functioning of Mega Health Insurance Scheme. Undoubtedly, this is an important issue as health affects all the citizens. The kind of enthusiasm the honourable members are expressing in the matter of public interest, and especially in the health sector, is really commendable. I am also grateful to all the other members also have participated in this discussion and made a very useful suggestion. Sir, the point number 1, the raised by the Honourable MLA from Mausram constituency, that I have made an announcement that this MHIS scheme with PMAJY will be launched on the 1st of October. I want to inform the House today, due to the technical reasons, we will not be able to launch this scheme on the 1st of October. We have to look after the new date how to launch the scheme, sir. Number 2, he has mentioned about the convergence, about Ayushman Bharat, MHIS. We the government, sir, we compel also to have a short break. He said, but not to have a break. But due to very, very serious technical reasons, for the price bidding by the insurance company, which are negotiating with the government of India, sir, we are compelled to have a break for few months this MHIS scheme to be after we have been launching, before we are launching, sir. So we are very serious in implementing the MHIS scheme. So government is taking all efforts to ensure that MHIS scheme is continued. Meghalaya is a role model of insurance scheme, as it's said by the Honorable MLA from Moseram. After the RSBY, conceptualized by the Government of India, we have convergence with the MHIS. Then we have launched a scheme in 2012, we continue till today. So, as I said, there is a role model, that health insurance scheme, where the other state in the country also has followed this mega health insurance scheme. So, cost of treatment, sir, just mentioned the Honorable MLA from Moseram, the rates. We have the specified items, sir, with the rates of all, particularly in surgery, which has mentioned with the Honorable MLA. So the help desk, we have made it mandatory, help desk to all the MPanel hospital, whether within the state or outside the state. Even the PHC, CHCs also. We have mandatory that we have the registration table, where the people before admitted, the patients, they have to first, before they admitted the hospital, they have to register in the help desk board, sir, which has already made it mandatory to all the MPanel hospitals, sir. So the hospital are very accommodated and cooperate with the people instead of some mistake, as was mentioned, whether it is he or she on putting on this, difference of sex, maybe has been slight mistake of enroll the he or she. Then the government is the hospital which you have seen, we have not received any complaints so far from any MPanel hospital or PHC, sir, on this regard. So hospital bills, we resort it out from time to time to claim all the bill MPanel in the hospital under the MHIS scheme. So awareness and attitude always been taken out on a regular basis. Since now, we want also the participations of all the stakeholders, the MLAs, the Darbar Shnong, the MDCs, the churches, even all the religious organizations. We can use the platform for publicity and awareness, sir, for enrollment of MHIS, sir. So also will have the online registration. The contact will be placed in every Darbar Shnong and all the localities, sir. So now the scheme is not limited only to 5 in the family. Now the government has decided all the residents of Meghalaya, will be enrolled. It will be enrolled to all the residents of Meghalaya, whether it is 5 or 6 or 7, there's no limit, there's no cap on enrollment, sir. Will be enrollments universally to all the residents of Meghalaya. So, Meral Bond, Honorable MLA from Nongpo, I would like to thank him for appreciating the MHIS scheme. They have done very well, number 1, number 2, and 3. And we are expecting number 4 will be doing very well, better than the MH1, 2, and 3 also, sir. So they're doing very good for the benefit of people, particularly for the benefit of the poor and the needy. Now will be included all the residents in our state, sir. List of treatment are already in place, sir. We have the list of treatment is already in place. Mr. B. George Lingdo, the Honorable MLA from Umroi constituency, is talking about the Ayushman Bharat. Ayushman Bharat, we have the special category populations, which is all the amount borne by the central government, the government of India. So now, from the Ayushman Bharat, we had covered 3.47 households in Meghalaya, sir. Ayushman Bharat, it is all, I have said, it is all covered by the government of India. It will be borne by the government of India, sir, all the expenditure. involved are incurred in that Ayushman Bharat. Led by the Honorable MLA from Mokhar constituency, we have taken notes of the point raised by the Honorable MLA. The blood banks, the government is intended to install all the blood banks in all the district hospital in Meghalaya. But sir, they need to meet the criteria to fulfill the norms of the setting up of the blood bank, sir. So the government of Meghalaya, through the state nodal agency, MHIS, has implemented the Mega Health Insurance Scheme since 2013, post its launch in December 2012. The Mega Health Insurance Scheme have been implemented in convergence with the Rashtriya Swasthya Bima Yojana, RSBY, which is a health insurance scheme designed to provide a health insurance coverage of 30,000 per family for the beneficiaries belonging to the BPL category. In order to target the universal health coverage, the government of Meghalaya expanded RSBY and universalized the scheme. The scheme was universalized by extending the benefit of RSBY to all the citizens of Meghalaya except the state and the central government employees. Simultaneously, the government increased the insurance coverage from rupees 1.60 lakhs in MHIS 1 to 2.5 lakhs in MHIS 2 and 2.8 lakhs to MHIS 3, plus the 30,000 senior citizens covered by enrolled senior citizens. The scheme was also improved by introducing tertiary and critical care treatment in the first year of implementation in attempts to universalize the scheme. Mega Health Insurance Scheme is one of the first successfully implemented universal health insurance program in India. Implementations of MHIS in the state of Meghalaya has been improving since the start of the scheme. In MHIS 1, the number of households enrolled under the scheme is 1,99,815, that is 46 persons, which increased to 3,46,548, 50.5 persons in MHIS 2, and further increased from 4 lakhs to 36,788 with 54.8% in MHIS 3. In terms of utilization by beneficiaries, a total number of 41,874 enrolled beneficiaries have been benefited from the scheme, amounting of 16.6 crores under MHIS 1